And thank you for joining us for a very special edition of Stuff That Matters. We are here with Dr. Cynthia Persily at the site of our transition home here in Milton, West Virginia. Very excited to have you here today. Our first live and in-person interview. Matt Simon joining us, Michael Connor. We're with us in spirit, obviously. Cynthia, thank you for joining us.
Thank you. Thanks for having me today.
Thanks, Dr. Persily. Yeah, we're going to be kind of doing some jujitsu around the mics today. But,
a little bit.
Yeah, thanks for coming. Can you just maybe start with, you recently had a career change, but for a while you were in a huge position within the state of West Virginia, and that's where we met a couple of years ago.
Yes.
Maybe go through just a little bit of your story over the last several years professionally. What have you been doing? And let's just start there.
Sure. Well, I always start at the beginning.
Okay.
And I'm a nurse. I was trained as a nurse, and I worked as a nurse for many, many years. I still work as a nurse, right? No matter what I do, I'm still working as a nurse. And so I come at everything with that perspective, and really that perspective of care, and that perspective of wanting everyone to be living at their highest potential.
Right.
So I was also a nurse practitioner. When we moved to West Virginia, 32 years ago from Philadelphia, big change, by the way, big change. But when we moved here, I was a faculty member at West Virginia University, and I also had a faculty practice in rural West Virginia. I was a women's health nurse practitioner at a rural health clinic. I provided prenatal care for women there, so very vulnerable women, and really got to understand the West Virginia culture and sort of the relationship between West Virginians and Appalachians and the healthcare system, and the insider-outsider perspective. Right. And so that was, I think, something good for me to learn very early on.
Did it take a while for you to be welcomed in as an insider? And what was the culture shift that you found?
Sure. So, well, in Philadelphia, I worked in the inner city. I worked with primarily poor women. And then I came to West Virginia and worked in rural West Virginia, again, with primarily poor women. Problems were very, very similar.
Yep.
The problems were problems of poverty, but there were also added issues, transportation issues, access to care. Those kinds of issues were a little bit different. On the trust thing, it's interesting. I was a nurse practitioner in that clinic for 15 years. It took up until about year 10 before people realized that I wasn't leaving. And I remember one patient said to me, other providers have just come and gone, or they come for 2 years to pay off their loans, and then they leave. And you've just been here, and that makes a huge difference to our community. So that also taught me something really important, I think, and about being there and about building that trust with populations. When I left WVU after 20 years. As a tenured professor, which is really kind of odd to do that, right? But I needed a new challenge. And so I was recruited to become the president and CEO of Highland Hospital, which is a psychiatric health system here in Charleston, in West Virginia. And so I was there for 7 years. During that time, I really began to understand sort of the brokenness of our system in healthcare, but also the real potential. And so we did a number of things. We kind of right-sized our system. We also, though, realized that there was a huge gap in residential programs for children, because in our acute psychiatric programs, we cared for children and adolescents, as well as adults.
Kids were getting stuck.
And kids were getting stuck. And no child should celebrate 2 birthdays in an acute psychiatric hospital. So we, after a lot of work and a lot of evaluation, we did open a 24-bed psychiatric residential treatment facility. So as we were talking earlier, Matt, about the issues of regulations and fire marshals and all of those things, right? I completely understand that, but just so important. And to see kids be able to thrive in a more residential facility, and to be able to have more contact with their families, and to really work to to transition back into their communities was really, really so rewarding. And I left there and went to the West Virginia Higher Education Policy Commission. I recently did a lecture, and when they did my intro, I said, geez, that lecture sounds like I can't hold a job. But I left there and went to the West Virginia Higher Education Policy Commission, where I was the Vice Chancellor for Health Sciences. And in that role, it took me kind of back to my education roots, but really focused on developing the workforce for the future.
Yeah.
And we had a real focus on behavioral health and the importance of the behavioral health workforce to provide access to care and to provide the services that we need, especially post-pandemic.
Yeah.
I started my job there the day before we got sent home for the pandemic.
Perfect timing.
Quite an introduction.
Yes.
Great orientation. I'm sure there were things that I missed during orientation,
Right.
But that's where I was through the entire pandemic, and really looking at, what do we need to develop this workforce for the future, and how do we go about that, and how do we go about that in a way that streamlines education, but also provides those people to provide care where we need them.
Right.
And we had, like I said, a very strong focus on behavioral health and the behavioral health workforce. We developed a behavioral health workforce initiative as sort of a corollary to a longstanding rural health initiative that we had, which was really, about attracting people into the profession, educating them, and then retaining them in the state, which of course we have a hard time with.
So we can increase access.
Exactly. And so eventually increasing access. We also realized that we had no data on the behavioral health care workforce. And so we actually worked really hard on developing a database that really looked at where are the gaps and why are we having these issues related to access. And so I was very, very, very happy. I say that was my dream job. At that job, I was planning actually to stay there until I retired. And right after things settled down from the pandemic, the Governor Justice at the time decided that he wanted to use some of the federal funds that were coming into West Virginia to really focus on building up the workforce in two professions that really took a hit during the pandemic: nursing. So of course, that was near and dear to my heart. And then emergency services. Both had really taken a hit. And we already knew there were shortages, but the pandemic really illuminated those shortages and really made them worse. And so I was charged with coming up with an initiative to spend about $58 million in 9 months on one-time money to increase the workforce in those two areas. And so what we did is really a discussion for another day. But suffice it to say, they were very successful. We're still seeing the very successful impact of that. The nursing workforce initiative has been refunded by the legislature for 2 additional years, and hopefully maybe again in the future. We've increased the numbers of nurses who are graduating in West Virginia for the first time in a very long time, and retaining them in West Virginia. So anyway, the governor's office called me one day and asked me, or texted me. They didn't call because I would have asked too many questions, right?
No, governor's texted. That's cool. Okay.
The governor didn't text, but his staff texted and said, "Can you meet with me tomorrow?" Well, I was actually on the beach in Turks and Caicos with my daughter, where we were celebrating her med school graduation. So I couldn't meet with them tomorrow, and they wouldn't tell me what they wanted. So a little anxious for the next 4 or 5 days until I could get home and meet with them. And they asked me if I would be willing to take on the challenge of being the cabinet secretary for the new Department of Human Services, which was a result of the legislature splitting the mega DHR department that had been in place in West Virginia for over 30 years. And they said it was going to be challenging.
Yep.
The programs under the Department of Human Services are Medicaid and CHIP and behavioral health. And
What year was this? This was 20.
this was in 2023.
Okay.
Right. And behavioral health and drug control policy
Sure.
and child services, child protective services, adult protective services, all the social services and all the programs that are really kind of under the spotlight.
Yeah, sure.
So I took a lot of time to think. I spent a lot of time talking with others and talking with people about working in the executive branch and also talking with people about the programs that were under this particular department, and finally decided to take the challenge. I've never backed away from a challenge in my life. And I knew I was only going to be there for 18 months because the governor was only going to be there for another 18 months.
Okay.
And so I knew that we had to jump in really quickly.
Mission to
right. So
hit this
really
B12 shot of momentum.
Exactly. And so I felt a sense of urgency,
Sure.
Which I think the entire department felt as well. They had kind of been in a lot of flux, and feeling like I was the third department secretary they had in about 6 months, because the one who had been there, Secretary Crouch, had been there for a long time. He had resigned his position, and then there was an interim for 6 months, and then I came in. So there was a lot of flux, but they were ready.
Yeah.
They really wanted to make change, and they had a lot of good things that were already started, a lot of good ideas. And my philosophy is basically you bring good people around you and you let them go.
Yeah.
Right.
Yep.
And you let them develop the programs that they know they are the experts.
Yep.
And I'm going to be your biggest cheerleader, and I'm going to be, out in front and taking the heat when we need to.
Right.
But we're going to build, and we're going to do this from a vision for each, every vulnerable West Virginian having what they need to live a long and healthy life.
Yeah.
And so that's what we did. And programs like the one that you're having your open house for today, and we're sitting in, just a result of that. It was, we knew that we needed care for residential care, transitional care for kids, especially kids with special populations like autism. And so we started looking outside of our state at what the model programs were. And we did this not only with autism, but we did it with everything that we were doing. Let's learn from others. Let's bring them here. Let's let them see what the opportunities are here and welcome them with open arms. And so I'm so excited to be here today and just to see this come to fruition.
Oh, I love that. Well, and it's interesting there's a lot in your story to talk about, obviously. And your career anthology seems like it spans multiple lifetimes. I don't think it's that you can't hold a job. I think it's that you clearly have tremendous value to bring multiple places. But
thank you.
So I joined New Hope in 2022, and I think early on I was like, why do we have West Virginia kids? I worked in the Carolinas in multiple residential places. I've never worked at a place that took out-of-state kids until I came to New Hope. And New Hope had about 15, 16. It just struck me as, oh, interesting. Okay, I'd love to go up and meet with some folks at some point. So our timing kind of intersected. And I will say this, though, right away, whenever I'm exploring doing something new, everything, new things are a risk, right? It's always easier to just not do new things. But you have to look at who's going to be the partners that come with us on this journey, because it's going to be tough. And especially if we're trying to do something different that maybe hasn't been done before, I really want to assess, do I feel like I'm surrounded by people who get what that means? Because it means we're going to break some eggs, we're going to make some mistakes, but we're going to do something that we're not going to keep repeating. And I think an early meeting with you and some other state officials gave us so much confidence that this is a state and this is a system to come in. And I don't think that had that wasn't the presiding reputation before. I think of maybe the state or something had happened there where it just there wasn't a lot of momentum of new providers and new things and new ideas. So clearly your timing must have injected some new life and and that was perfect timing for us, because that really came at a time where, and we could feel it, like in meeting with you and some members of your team, it was so clear that there was like a hunger for new and for different, and there was going to be support. And the whole journey, the last couple of years, that has not stopped at all. Obviously, we were disappointed. We were kind of bummed that, we had a change in leadership and government, all that stuff, but things change. But what you put in place, really, I think is sustaining like that momentum. It feels like it's an exciting time in the state. So
yeah, I think so. I think I'm a big Brene Brown fan.
Sure.
Right?
Oh, yeah.
So dare greatly is
Sure.
kind of my motto at this point.
Yep.
I think that if we don't try new things, we're always going to get the same result.
Right.
And to your point, we are sending West Virginia children to so many other states,
Right.
and we have the capacity to do that here.
Right.
We may not have had the expertise before, but we have the capacity, and we have the people who care enough.
Right.
And it's the right thing to do.
Right.
It's the right thing to do for kids, so that they're here and they're close to home and they can be a part of their community. And it's the right thing to do for families.
Right.
And
Absolutely.
so, I can't imagine having a child who has been sent to South Carolina, or having to
And we're not
take my
we're
child.
Not that far in relation to where some kids go. Kids are in Utah, Texas, Florida. Yeah.
Exactly. So, and quite frankly, and not to get into the weeds, but that is having children in other states is part of what places a stress on the system.
Yes.
Right? Because we still have the same responsibilities for those children. Right. And so if I need to go and visit a child in Milton, West Virginia, versus going to visit a child once a month in Florida, that is going to put a stress on my system.
Absolutely. Right.
So
time, resources.
It's just for so many reasons, it's the right thing to do. And our providers are so busy caring for the children that they do have, that sometimes they don't have that time or that expertise to sit down and think about how do we do something different.
Right. Yeah. Well, and things have, we've noticed, and I've noticed just in the space, post-COVID, and there's data to support it, there's just a lot of challenges out there, right? There's a lot, families and youth and adolescents. There is I'm sure certain providers feel like, hey, we're doing the same thing we've always done, but it's just getting harder, and they can't quite put their finger on it. And so more and more kids being placed. But sometimes systems, I do think every system needs an injection of new every now and then. Like I think all systems have a tendency to drift towards just complacency, and so every now and then just a little bit of an injection. That's New Hope kind of feels like we're not going to come save the day. Like that's not what we're trying to do. We're not trying to even compete with anybody, but maybe we can just start injecting a little bit of newness, and then other people can say, hey, how did they do? Oh, maybe we could do that. And a lot of it's just asking the questions. Like we just said, hey, what do you need? Who's being sent out of state? And let's start from that conversation. Like, let's start with how do we serve these kids, and let's work backwards from that, as opposed to trying to kind of build it onto an existing infrastructure. Sometimes it's best just to clear the whiteboard and start blank. And how do we serve that kid safely in this community?
Sure. And that's, I think, what makes this program special is that philosophy of doing the right thing for each child. Yeah. Quite frankly, I would be satisfied if we got to a point where our care was evidence-based and it was trauma-informed, and that would be a great first level playing field to start with. And unfortunately, when we do the same things over and over and over again for years and decades, sometimes we aren't using the best evidence, or we are not using a trauma-informed environment. And so we do need to make that shift. Ideally, that would happen organically. Sometimes it has to happen as we hold providers accountable for it. And from a state perspective, during my term as cabinet secretary, it was, really a discussion of money, right? The dollar will drive change sometimes. And so that, we do that all the time, is we use reimbursement to drive the outcomes that we want. And so, but this is such an amazing first step. And it's an amazing opportunity. I can't tell you how many times people would call me from the community and say, my nephew or my neighbor or has autism and there's no place for them to be and they really need this care and the only place they can go is such and such a place and it's not here. And so West Virginia is just ripe for this kind of a program that is going to really keep kids here and bring them back into their communities.
Like I said, we're excited for it specifically. I'm almost more excited for what I feel like it represents for the system and for the future. And again, we genuinely hope that, every 2 months that there's a new press release about somebody else trying to do something
absolutely
new and different. Because again, there is anybody in my space of like human services, particularly in like adolescent mental health care, that views this as a competition. I just don't understand that because the supply and demand there's no competition. Our wait lists are too long. There's too much need out there. What we're competing against, we're competing for talent, but that's not even competing against each other. To your point, it's competing against workforce dynamics where we need to draw people. We need a bigger talent pool to all draw from. But we'd love, man, to keep seeing a bunch of new providers or existing providers try new things. And so let me ask you this. What was your proudest moment in state government? What was your most challenging experience trying to lead at state government?
So my proudest moment, I think, is really a collection of moments. And that is that, people in West Virginia say we have a child welfare crisis. I'm so tired of hearing those three words together. Because we don't have a child welfare crisis. What we have is an overloaded system. And we have workers who have become the brunt of all of the criticisms when all they're out there trying to do is the best that they can do every single solitary day in very difficult situations, situations that none of us would ever want to be a part of. And they're dealing with that every single solitary day. And through a lot of work with the team and a lot of work with kind of just talking with these workers, I realized that they never felt heard before, and they never felt supported before.
Just dumped on all the time.
Right. Dumped on all the time. And so the most challenging moments led to the most proud moments because I was able to stand up for our workers. And so, when the press or the legislature or the public are criticizing, the proudest moments were when I could stand up and tell their story and tell them what it is that is happening in the system and how hard these people are working to try to work within a system that, quite frankly, was built to have half of the number of children in it that we currently have. And with all of the other issues that are happening in the system, the opioid crisis, the funding shortages, all of the things that impact the work that they're doing. And they're just boots on the ground trying to work hard. So after one particularly challenging situation, I basically, had to go on television and during a press conference, and really I stood up for the workers. And I received so many emails and phone calls from workers who I'd never met before, who said, we have never felt so supported. And that's all they needed. That's all they needed to really feel like the work that they do matters, because they're really feeling like the work that they do doesn't matter. And it matters to families, but because of all the confidentiality around child welfare, for instance, I mean, even related to healthcare, you can't tell the public the stories of what you're doing. So you can't share the successes. The only thing that you hear about is what hits the news because it became a law enforcement issue or something else. And so you haven't heard all of the successes and all of the good things. And so they just really needed someone to support them and to really stand up for them.
It's a weird, I think sometimes people are uncomfortable with the word. I use it a lot internally. We actually have a bi-weekly meeting about it, like branding. And that because branding can kind of feel like are we selling shoes here or something? But no, branding's about what is the sense of pride in what a collective group of people are doing or not doing. And I do think healthcare, particularly on the public side, public child welfare, needs all kinds of branding overhaul. And I know there's a lot of challenges, but I struggle with, the advocacy groups of the world who I know are coming at it with in good faith and want a system to get better. But if all you're doing is making that look like the most unappealing career path for a budding human servant, how is that going to help us if we wake up one day with 10 times as many kids and 3 times less social workers?
Exactly.
How do we get to better that way?
Right.
It's got to be that, no, this is a noble profession. This is a phenomenal profession. This is we're going to invest in you. Yes, there's going to be hard days, but there's going to be amazing. But yeah, that kind of collective pile on that can happen sometimes with media groups and stuff trying to advocate change. Sometimes they, I think, inadvertently move things backwards. And it takes, I think, a leader to say, I got to hip check you guys on this.
It does. Yeah. It does. I think way back when we had that meeting, when you all initially were coming to West Virginia, and we had such a very robust conversation, and lots of people from West Virginia in the room, and your team in the room. And I think I said this at the end, because I've said it a lot, is how dare anyone say that we don't care about children in West Virginia?
Right.
Because these are the kinds of conversations that I was in every single day about people looking at what are the viable options that we have that we can really put into place and put into place quickly.
Right.
We also developed, and so this is another proud moment, and it came again out of challenges. So what we knew is that we had a huge turnover of child welfare workers. So staying in that child welfare space, we had a huge turnover, and especially in the supervisory role, it's an aging workforce, right?
Sure.
As most health and social services are. So we had a huge turnover, and we had a lot of new people put into supervisory roles. Now, you're a worker, maybe you're a great worker,
right,
but you may not have any preparation for being a supervisor, leading. Plus, remember, you were that worker who was feeling not supported, right? And so how do we help them be better leaders so that they help to keep the people that work for them, right? I mean, people don't leave a job, they leave their leader, right? And so we have a program at the state that's called Kids Thrive, and it's all about our kids and getting them into the right level of care and all of the good things we can do for children. So we developed a program called Leaders Thrive. And so it was a leadership development program for those emerging leaders, those new leaders. I sat in the first session, we did 4 groups, 4 cohorts around the state. And I sat in the first session in each region. And I heard people say, yeah, I've been with the department for 20 years. I've been in my manager role for 6 months. I've been with the department for 38 years. I've been in my manager role for 1 month.
Oh, wow.
And so we have all of this wealth of knowledge and expertise, but again, that culture of what we do doesn't matter, or whatever we do, we're going to be criticized. So we wanted to really give them the tools to lead and to help their county thrive. And so we had about 45 people across the cohorts, and they graduated in December.
Oh, that's awesome.
And we only lost about 2 of them, and that was because they ended up retiring. And it was so fabulous to sit there. We had a local consulting group called Epiphany, who does this kind of work, who worked with them over the course of the 9 months. And at the end of kind of the ceremony piece, we asked them to say what difference it made for them. Because at the first session, when I was there with each of them, I said, if this doesn't make you different, then you've wasted your time. Because this should make you a different person. It should make you think differently and feel differently. And to hear how many of them said that, that they, and that their teams were noticing. that their teams were noticing a difference. I mean, we had two people in one of the cohorts from the same county, and one of their team members actually said, "What's going on with you two? Because you never got along before, and now you're like bonded."
Having these like critical thinking skills and are able to just
exactly.
Yeah.
And it also created a safe place for them and a network outside of their county to know that everyone was dealing with the same kinds of issues, but to be able to safely talk about that. And at the end, former Commissioner for Social Services, Jeff Pack, was there, and he raised his hand and said he wanted to say something. And he said, I have to admit something. When you brought this idea, because I'm a big leadership development junkie, right? I ran a leadership development program. I've been through a number of them, including one with the Robert Wood Johnson Foundation. I just believe in the power of leadership development, especially formal programs. And he goes, when you brought this to me, I was like, this is so stupid. This is not going to do anything. It's just another thing. And one of the people who stood up said, I've probably been to 20 different leadership development or manager training programs since I've been at the state, and nothing has impacted me like this. And so he said, I just thought that this was hogwash, that it was not going to make a bit of difference. And he said, I am now I can see you all look different. You're acting differently. You're speaking differently. You're just, it's changed you. And he said, I will forever be, a supporter of this kind of development program. Right. So
I think that
another proud moment.
Oh, that's so cool. And the front, we actually just did some similar things with frontline supervisor investment. And I think that especially that frontline layer is so critical to any organization, but particularly human services, because they're really, and our CEO actually just started reading the book, Patients Come Second.
Yes.
And that's, and again, that can feel like, not something you're supposed to say in healthcare, but obviously the theory being that if you help the helpers, most of them want to provide good care.
Yes.
They want to be compassionate. They want to show up at a 9 out of 10 and not a 4 out of 10, but they need to be invested in. And I think that's a home run. And again, sometimes I think the private sector leans all the way into that. Sometimes the public sector feels like, no, we're good. We don't need, and I like, no, these all play by the same rules. We're all leadership is leadership. Whether you're on the private side or public.
It is. And again, just because you're a great bedside nurse doesn't mean you're going to be a great manager. Just because you are the best
totally different
EMT in the entire world doesn't mean that you're going to be a great manager. And the same thing in any of the human services. So,
and to your point, if you're already a somewhat burnt out
exactly, if you're already exactly,
and you don't know how to delegate or you don't know how to manage time,
and
so that's awesome.
You pass that on to your people,
right?
Yeah. And what you bring with you just gets passed on.
Oh, well, that's great that they just that's got to be exciting. It feels like you have a bunch of kids that you just graduated.
I know it does. I was so proud. I was just really, really proud.
Oh, that's awesome.
25 and 12. Simple, seemingly ordinary numbers, but these numbers hold a special meaning at New Hope and prompted us to take action. 25, the percentage of young men diagnosed with an autism spectrum disorder, a number that is growing. 12, the average number of months families must wait for specialized residential treatment. But those days are over. Welcome to New Hope's Learning Enriched Autism Program, or as we like to call it, LEAP. New Hope may not change the 25, but we're impacting the 12. We're expanding this program from 6 to 20 beds, investing in the highest quality of treatment models and support systems. LEAP's team of specialists combines the best autism research with trauma-informed care and relational connections to create an environment where our youth thrive. At LEAP, youth learn the skills to reintegrate into their communities and chase their dreams. Families receive the support and resources to ensure this is the last residential treatment they'll ever need. With our enhanced program, the number that holds the most meaning to us now is 40. That's the number of successful LEAP graduates we anticipate annually. That's 40 lives changed. That's 40 families finding new hope through LEAP. That's our name. That's our promise.
to your point, one of the overarching themes of the Leadership Academy we had, what was it, about a month ago now?
Yeah.
Was stagnation and not falling into a state of stagnation, which tends to happen with a lot of individuals who have been with the organization for a very long time, are great workers, but don't really have that desire, passion to take the next step, fall into a leadership role, manage others. They're great at what they do, but they just want to stay in that lane. And I guess, the Leadership Academy, what you're emphasizing is pushing yourself to get to that next level, taking on more responsibility so that you can provide better care for the kids, obviously, in our case, or be a better leader so that you're a more well-rounded professional and really bringing up the skills of others that work around you.
I mean, get uncomfortable, right? Just get uncomfortable. I constantly put myself in situations where I'm uncomfortable. And then I think, why in the world did I do that? Why did I put myself through that? But it's always, when you look at on the other end, it's really an important growth opportunity. But I also think it's okay to not want to do that and to stay and be that best
individual
social worker, the best person at, we need those people. We need them, and we need them to be training people like them. So I think there's that balance of, pushing people who have that potential and have that one, but then how do we reward those who are staying in those roles that are direct service roles? And so, I give credit to the legislature here in West Virginia for some work that they did on kind of developing sort of a career ladder for our social services workers, so that they are, even if they want to stay at the bedside in my vernacular, they can, and they have opportunities to advance. So that's I think that's credit to the team before me and the legislature for really having the foresight to do that.
So in kind of in the child mental health space, and obviously I know you've transitioned out of state government, you've got a new adventure coming up, but what do you see, crystal ball the next 5 years of West Virginia? What do you hope to see things grow, whether is it investment in residential, foster care, community, like evidence-based practice? Is there anything that has already been put into place? It just hasn't been activated yet. What do you see as the future of child mental health?
Sure. What I see in the future is this momentum keeping up. And I really do think that the ball is rolling. People are really behind this. A lot of the pieces have now been put into place. For instance, the Certified Community Behavioral Health Center model, which we put into place on October 1st. And they're just sort of getting that, getting that model implemented in those centers where those CCBHCs are. That's just going to allow us to wrap children in services. And so they will no longer have, 20 different providers who are out there kind of. So I think the momentum with the things that we put into place will continue. I worry about what, cuts to Medicaid might mean, or, because we have a very successful serious mental illness waiver program for children. And so we want to make sure that children can still access mental health care when they need it. But I think we need to keep the positive and know that lots of ground has been laid and the ball is rolling and people are getting on board.
Yeah, I'm hoping, obviously we keep an eye on all of the things because we are an organization that serves 99.9% Medicaid youth and lower socioeconomic families. And I'm hoping, because everything, and we're not a political podcast at all, but everything feels political nowadays, which is silly. I'm hoping kind of child mental health is maybe the one thing that's not. It feels like maybe this is the one corner of the world where we can all just agree, kids should be safe, kids should be healthy. If a kid, God forbid, went through trauma as a kid, let's make sure they get care. Doesn't matter who they end up voting for. We want healthier kids. So I'm hoping that stays safe and we continue to invest, because there's if we invest in our kids, there are Republican and Democrat arguments to make for investing in our kids. It's not a political thing.
Absolutely.
So we're keeping an eye on it too. But I too hope that the momentum actually can, because sometimes momentum can double and trickle down as that snowball rolls down the hill. It actually doesn't get just faster; it can get bigger. And we're going to be a vocal. Our first graduate of this program they won't know his name, but the whole world is going to know
Right.
that happened,
Right.
because they need to know that happened.
They need to hear the stories.
Right.
And I mean, that's what rings true for everyone, is the
Right.
stories, and to be able to tell that story. And it just makes others, like you said in the earlier in this session, is that, as we start to do things differently and other people seeing us do things differently, that momentum will build.
Yeah. People want to be a part of a movement. People want to be a part of something exciting. And that because we're doing a lot of recruiting right now and hiring for this program and our next couple programs, we're working on a video, kind of like a promotion video about West Virginia. And it's going to be narrated by our program director, who has the best West Virginia voice I've ever heard in my life. But we were kind of writing the script, and I wrote it, and our West Virginia staff, our directors who live in the state, I'm an outsider, they're an insider.
Sure.
It was really cool. They edited a couple things, because some of it was highlight, they said the same thing as you. Hey, we're kind of sick of highlighting the negative. We don't want to, let's not talk about all the crazy, everybody knows that there's residual problems from opioids and things like that. Let's highlight what's working and triple down on what's working, as opposed to just getting away from that narrative that has followed West Virginia for so long. And I said, absolutely, let's go.
Well, and unfortunately, I believe that the traditional media doesn't want to tell that story.
Right.
And so we have to look at those alternatives and how we tell the story in different ways. So is it podcasts? Is it short videos? Is it because press releases about good things don't necessarily make an impact at this point.
No.
And so I think that is a real challenge for human services, to be able to really look at how we tell our story in a different way and use new mediums to do that.
And it's not being Pollyannic, but I mean, there's some good news around there around opioid decrease. Like, there's some things that are
absolutely
getting better. And I don't, anybody who's not interested in celebrating that, I have to question, why are they interested in maintaining the status quo?
Yeah. The newest data on overdose deaths in West Virginia is phenomenal. And that really goes back to, we spent a lot of time looking at evidence-based interventions, and naloxone happens to be one of them. Treatment happens to be one of them. People who are in treatment don't overdose. So if you look at the data that supports the interventions, it's what's really
not unsolvable.
Exactly.
They're daunting, but they're not unsolvable.
They are. Right.
Real quick, one last thing for me before we close. One of the overarching themes and mantras for us, the reason why we're here today, is keeping West Virginia's youth home. Just how important is that? I mean, I can only imagine the stress that goes on, not just with the youth, but also the families involved too. As you mentioned earlier, when you're getting calls with individuals, this house today here in Milton, specializing youth males with autism spectrum disorder, and just that level of stress that goes on when not knowing where to place their child and having to possibly send them hundreds, if not thousands of miles away. So keeping West Virginia's youth home, just how critical is that, the over, need for that, and with our services too, how vital is it going to be?
It's absolutely critical for so many reasons, some of which you've already said, but West Virginians care for each other, right? And, if you look even at our state custody numbers, the majority of children who are in state custody are placed with kin. The highest number in the entire country are placed with kin. The highest percentage in the entire country are placed with kin. West Virginians take care of their own. And to have a child be able to be taken care of by West Virginians here in West Virginia, outside of the fact that their family can be more involved, but that, going back to my initial story, it took me a while to understand West Virginia and West Virginia culture, and to really understand the role of the family and the role of Appalachian culture in everyday life. And so to have our children being cared for by West Virginians is just critical.
Oh, I love that. I didn't know that data point. That's a phenomenal kinship care. So important. But that means that there's something in the water of those aunts and uncles and grandmas and who step
no question.
Step up.
No question.
I love that. Yeah,
awesome. Well, it's noon. A little afternoon here. About lunchtime. I hear some footsteps upstairs. So we're going to wrap up. Final question for you. The only pre-planned question that we've had going for a year and a half now. So, Cynthia, for you, what is the stuff that matters?
So I think the stuff that matters is people. And those people can be people who are families, people who are children who are in need of help, or they can be our workers who are providing services. There are healthcare workers, there are social services workers, there are all of those people. That's what matters. And that's what matters to me. And I keep that in mind with every decision that I ever make. And every time I present an argument, I present it based on the impact on people. And I think that's what matters.
Well, I think I could safely say, Dr. Persily, I don't think we would be sitting here had it not been for your leadership. I want you to know that.
Thank you.
And so I want to thank you on behalf of the future kids that are going to be served here and in other places. And then again, hopefully other places that get inspired by this place. And we will try to make you proud. And
already doing it.
we wish you the best in your next venture. But I know you'll continue to be a supporter and we'll all continue to collaborate. We're also not going anywhere anytime soon. So
that's the important part.
Yeah, absolutely. Well, thank you so much for your time today. It was a real pleasure. This was awesome.
Thank you.
Our first, we didn't do too much of the mics. We did pretty good.
Thank you so much.
You're a pro. Yeah, I was like from one of mine.
From what you know beforehand, this is not our first podcast.
Yeah, it's not our first rodeo.
Experience, not our first rodeo.
Yeah. Well, thank you, Dr. Persily. Appreciate it.
Thank you so much.
Yep.